Hello, my name is Shay Hebert, and I am coming to you today to talk about splitting the anxiety hairs. I will be answering the 3 questions that are on our weekly video discussion prompt. Let's get started. The first slide is an overview of what we will be talking about today. We will be talking about the key factors that define anxiety disorders, excessive fear and anxiety, and related behavioral disturbances. We will discuss the differences between general anxiety and social anxiety. Furthermore, we will also talk about the diagnostic criteria, associated features, prevalence, development course, and prognostic factors of general anxiety disorder and social anxiety disorder. And lastly, we will mention why it is important to have specifiers and modifiers when diagnosing clients. So, what are the key factors that define anxiety disorders? Excessive fear, anxiety. Clients have fear of certain future occurrences that cause behavioral disturbances in their daily lives. There are presence of physical reactions. Clients exhibit vigilance in preparation for future danger, which leads to cautious or avoidant behaviors. Panic attacks can also be present. There is a presence of muscle tension, irritability, sleep difficulty, energy, and restlessness and attention. Some general information about anxiety disorders is that a close examination of triggers that cue the fear is needed. The anxiety lasts 6 months or longer. Substance abuse and medication usage or another medical disorder have been ruled out. And anxiety disorders can be acute or chronic. From a diagnostic perspective, the difference between general anxiety disorder and social anxiety disorder are that general anxiety disorder has excessive anxiety that occurs on most days for at least 6 months or longer. 3 or more of the criteria that were listed on the previous slide for an anxiety disorder is present. We need both anxious thoughts and specific behaviors before a diagnosis can be made. Associated features of general anxiety disorder are worry about everyday routine life, such as responsibilities, finances, and their health. General anxiety disorder symptoms are pervasive, distressing, and they occur without precipitants. CBT and SSRIs can be effective treatments. The prevalence of general anxiety disorder is at 9% among adolescents and 29% among adults. And it occurs more often in women than in men. The development and course of general anxiety disorder is that reports that they have felt anxious and nervous all their life. The average onset of this disorder is 35 years old, and it waxes and wanes all their life. Some prognostic factors of general anxiety disorder are behavioral inhibition, client exhibits neuroticism, harm avoidance, they are reward dependent, and an environmental factor of general anxiety disorder is that it can be carried genetically and it can be instigated by an overprotective parent. On slide 5, we see social anxiety disorder. The diagnostic criteria for this disorder is that it is focused on a specific area of social rejection. It affects 10% of the population. It includes clinically significant distress that has lasted for 6 months or longer. And it also has impairments in social or occupational or other important areas of functioning. The associated features of social anxiety disorder are that clients act extra assertive, excessively submissive, or controlling when in social settings. Some physical symptoms are trembling, twitching, feeling shaky, muscle aches or soreness, irritable bowel syndrome, and headaches might be present. Cognitive behavioral therapy and SSRIs could be effective treatments. The prevalence of social anxiety disorder is that it occurs in 7%, but it decreases after age 65. It is higher in women than in men, and it is more pronounced in adolescents and young adults. The development and course of social anxiety disorder is that it has a medium onset age of 13 years old, and 75% of individuals have an onset of social anxiety disorder between the ages of 8 and 15 years old. The prognostic factors of social anxiety disorder is that clients tend to have high neuroticism and low extroversion. They could be a subject of peer victimization, having growing up. High behavioral inhibition, which is the tendency to avoid or withdraw from new experiences, people, or environments, can also exist in clients with social anxiety disorder. Some specifiers and modifiers that are outlined for clinicians to use when diagnosing clients with anxiety disorders are that specifiers help counselors keep track of code numbers for billing. It helps them to gauge the risk management of clients, and it also names the specified type of diagnosis. Modifiers allow for transparency of services provided. It keeps record of treatments used on the clients, and it tracks data for clinicians to use throughout the treatment process. Finally, the references used for the course of study in gathering this information are from the APA, the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, revised, from the American Psychiatric Association Publishing. The second reference used is Memorable Psychology and Neurology, printed October 4th, 2021. Filmed October 4th, 2021. The video is named Anxiety Disorders, Mnemonics, Memorable Psychiatry Lecture. All of the videos that Dr. B linked for us for this assignment were very informative and interesting to watch. Thank you for your time, and I hope you have a great day.